Welcome back, guys. Happy to see you. Today we're gonna go have a look at the health clinic co-op.
Okay, well, I'm Harold Chapman, and I've been a member of the community clinic since July of 1962. And in July 1962, while the doctors were on strike, I was saying to myself, what am I going to tell my children years from now when they ask what you were doing while those doctors were on strike? Well, what I was doing was helping to organize a cooperative clinic so we could own and control our own services. That's what I was doing.
A health clinic that is owned and governed by its members. Members can be users of services. They can also be people who work at the clinic. It depends on the bylaws of the organization and also what the Cooperative Act says about who can be on the board.
Our healthcare cooperative would be different than for a regular doctor's office, for example, because we have people who run for our board of directors, members. People can become members, they can get involved in the cooperative, they can participate in the board of directors, they can serve as a volunteer, and most importantly, they help us with decision making and planning both the short and long-term future of the organization. At the Saskatoon Community Clinic, we provide a whole range of primary healthcare services. We have two sites, one here, downtown Saskatoon, and one on 20th Street in what we call the core neighborhood of Saskatoon. And through these two sites, we provide physician services, nurse practitioner services. We provide a lot of group programs. We have physiotherapists, counselors. We have a whole range of primary healthcare services. What we're aiming to do is meet the needs of the whole person. So we recognize that healthcare is far more than just services that you receive from a physician. Primary healthcare has many important aspects, including your physical being, but also your emotional being, and also the community in which you live.
The Health Information Center, we started it probably in May, I think it was 1995, and at that time we wanted to engage our patients in taking care of their own health. And so this was one mode that we chose to use. We have pamphlets that they can take away with them. We have books that they can also borrow. And we have websites that are Canadian that we would refer patients to if they feel that they want to check the internet at home.
I think the primary benefit of being a member of a healthcare co-op is that you do have the opportunity to have a say, to become involved in decision making. So you have the opportunity to run for the board of directors if you want to, and then be directly involved in overseeing the work of the executive director and setting the strategic directions of the organization. If you don't want to run for the board, you have other opportunities to get involved and to influence the board. So for example, you can go to the annual meeting or the semi-annual members meeting and have a say in what goes on here. So I think that's the main benefit. And I think that there is some evidence that having users involved in care delivery actually creates better care outcomes.
Anybody in the community can become a member of the Saskatoon Community Clinic. We don't restrict membership in any way. Now, not everybody who uses our services is a member. To use the Saskatoon Community Clinic, you do not have to be a member. We believe in universal health care. We receive most of our money through the provincial government. So our services are universally accessible to anybody who needs them in the community. So membership is optional, but it is open to anybody in the community who wishes to receive a membership in our healthcare cooperative.
I think the exposure to the cooperative model, there's a lot of opportunity here to become involved, either on the board, so directly in decision making, or you could also join a committee like the Political and Social Action Committee. So I think it's a good opportunity to develop leadership skills and just become more informed about our healthcare system, opportunities for different kinds of healthcare delivery.
Each of the health healthcare cooperatives in Saskatchewan design the services that are unique to them in their community. So an advantage of having a primary healthcare cooperative is that the people who are involved in that healthcare cooperative can respond to the healthcare needs of the community and what is needed by the community and the members of that cooperative.